Type 2 diabetes is a disease which is seen in about 95% of the diabetics. Only 5% or less are type 1 diabetes. Type 1 is where they need insulin right from the beginning and tablets will not help. That is type 1. It usually comes at a young age. Type 2 usually comes after the age of 25 or 30, and they can manage with tablets for the first few years, and then insulin may be utilized or needed. That is type 2 diabetes. Caused and increased a lot because of our lifestyle changes, because of the type of food we eat, which is more carbohydrate based, instead of being more of fiber like vegetables, salad, fruit, and more of protein. It is more carbohydrates. Then we have more sedentary lifestyle, less exercise, less activity. There's more stress in society, and there are genetic factors. So all this is increasing the level of type 2 diabetes. So what people can do is to have less sugars, less carbohydrates in the diet right from the beginning as a preventive. They should do regular exercise, eat smaller meals and in moderation, enjoy everything in moderation. Then the the level of diabetes will be reduced. And those where the diabetes goes on increasing, they are put on medicines first. Now, when medicines are able to control them easily, it is all right, they can stay on that. If it is not able to control them easily, then they have the option of surgery. And we have a specific surgery for diabetes which can control and cure type 2 diabetes. So people need to know that there is an alternative available. And this operation is a laparoscopic operation. It is a Brazilian method started 10 years ago. Then we were the second team in the world to learn and to start it in India in 2008, more than 5 years ago. And now we are helping to spread it in other parts of the country and also other parts of the world, because we are regularly doing work now in Istanbul and in Turkey, and we have been approached by hospitals in the Gulf region, in Austria, in Poland, and hopefully we will be able to help other teams to learn this procedure and to start this surgery and make it available, because many times bariatric operations are used to control diabetes also. But within 5 years, more than 40% of the patients have recurrence of diabetes. Plus, in bariatric operations, many of the operations have malabsorption and malnutrition as a side effect. While in this operation that we do called ileal interposition, there is no malabsorption or malnutrition, no long-term side effects, and the result is between a 90 to 95% cure rate of diabetes. The treatment is expected, the effect is expected to last lifelong, because it improves a hormone called GLP-1 in the body. That hormone improves the pancreatic cells. So once they cross the first 3 to 4 years, the pancreatic cells go on improving. So that keeps the effect going for the rest of their life. And the quality of life is normal, is better than before, because they have more energy, they can do more work, they can eat normal food. They will not progress now into complications because their sugar levels are normal range. The success percentage is between 90 and 95% of success of this surgery, and the remaining have improvement but not complete eradication of the diabetes, but they have an improvement.